Hello, it's me again, but today we have a different topic. Intravenous iron in patients undergoing maintenance hemodialysis. So, the definition. Anemia is a common manifestation in patients with chronic renal failure and constant finding in chronic hemodialysis patients. Factors contributing to the occurrence of anemia in CRF patients are insufficient renal production and secretion of erythropoietin, impaired erythropoiesis due to the presence of erythrotoxins, and decreases erythrocyte half-life. In addition, CRF patients on hemodialysis or continuous ambulatory peritoneal dialysis (CAPD) suffer increased blood loss due to their own dialysis and laboratory sampling. Also, blood loss due to gastrointestinal injuries and the use of anticoagulants and antithrombotics is frequent in CRF patients. Gastrointestinal bleeding has a prevalence of 18%, 7.3%, and 6.3% in predialysis, peritoneal dialysis, and hemodialysis patients, respectively. Now, the application.
I just got this video about iron infusion. So I got this 35-year-old lady. She presented with chronic tiredness, and blood test showed that she has got very low iron. So she has come here for a iron infusion. As you can see here, we have pop in a drip into her left arm, and we have put up this iron product. It's called Ferinject or iron carboxymaltose. Which is 1,000 milligram in 20 ml vial. We have put that into a bag of 250 ml of normal saline, and it's infusing this iron, which is 1 gram of carboxymaltose in 250 ml of saline into her left arm over a period of 20 to 30 minutes. So this is just an introduction to how people have iron infusion.
In medicine, intravenous iron sucrose is a complex that possesses adequate stability to allow rapid competitive exchange of iron between iron sucrose and selective iron binding proteins such as the transferrin and ferritin. These properties of intravenous iron sucrose are crucial in patients with a clinical need for rapid release of iron to iron stores, with iron deficit anemia due to insufficient iron intake or iron loss, oral iron intolerance or non-compliant with oral iron therapy. In patients receiving erythropoietin therapy, administration of intravenous iron resource can each optimization of erythropoiesis and significantly reduce erythropoietin requirements and thus treatment costs. Now, the pros and cons. The pros: correction of anemia in CRF patients improves survival, decreases morbidity, and increases quality of life. Intravenous iron sucrose is safe and well tolerated in the treatment and prevention of iron deficiency anemia. In addition, the rates of hypersensitive reactions due to iron sucrose administration are extremely low compared to those of their parental iron preparations such as iron dextran or iron gluconate. Now, the cons. The administration of intravenous iron is not, however, free of adverse effects. Among these, we distinguish certain predictable reactions under the consequence of pharmacological action of iron, such as side effects, from unpredictable reactions in immunologically sensitive or subjects such as hypersensitive and anaphylactic reactions. Issue applied in Ecuador. Researching in the publication of the Ministry of Public Health (MSP) protocols of the management of the patients with chronic renal failure who are being treated with hemodialysis, it was able to find that the use iron orally. It suggests that the administration of the iron be done orally since the patient is probable candidate for RRT, renal replacement therapy, and thus preserve the vascularity in the upper limbs, as indicated in the protocol of MSP. And now, on the conclusion, iron sucrose has a good safety profile and represents a low risk alternative to oral iron therapy. It does not contain dextran, which prevents the induction of anaphylactic reaction previously observed with the administration of intravenous iron dextran, and avoids to occurrence of histotoxicity observed with the treatment of iron deficiency anemia with level iron complexes, such as iron gluconate. Thank you.